Thank you for visiting Care for PA to learn how you can help your community hospital during the very important state and federal budget processes. Today, I'll explain how the budget process works and tell you how to help ensure patients and communities in Pennsylvania continue to have access to outstanding care, programs, and services that they have come to expect. First, let's start with Pennsylvania, whose fiscal year runs from July 1 to June 30th. The most public part of the state budget process takes place between the time the governor introduces his budget in early February and the time the state constitution requires the budget be completed by June 30th. However, the budget process runs nearly year-round. The introduction of a proposed budget follows months of work that begin in late summer. The governor, his policy staff, cabinet secretaries, and the Office of Budget work together to create, audit, and fine-tune the budget before it's introduced in early February. Once the budget is introduced, the House and Senate hold public hearings on the different areas of spending. Some of the largest dollar amounts in the budget include the Department of Public Welfare and the Department of Health, both which have a significant impact on hospitals and health systems and the patients and communities that they serve. At the federal level, whose fiscal year runs from October 1 to September the 30th, a similar process is followed. The President and his staff, cabinet secretaries, and the Office of Management and Budget prepare a budget which is sent to Congress usually following the President's State of the Union speech in January. As in Pennsylvania, public hearings are conducted. Because of the size of the federal budget, there are 13 separate appropriations bills. The one that is most important to the hospital community is the Labor, Health, and Human Services Budget Bill, which includes all Medicare and Medicaid spending. The current economic downturn will likely continue through the third quarter of this year, if not longer. Less revenue and possible changes from federal health reform efforts mean that there will be less money available to distribute in the budget. Medicare and Medicaid programs and services that are important to the hospital community may be cut. The hospital community will need to be educating both state and federal elected officials that cuts to Medicare and Medicaid will hurt patients and communities. The Hospital and Healthsystem Association of Pennsylvania will work with your hospitals to alert you through this website when your help is needed to help ensure that your hospitals will have the resources it needs to care for patients and your communities. You may be asked to email your state and federal lawmakers or to sign an online petition. Hospital leaders may be asked to meet with your community's lawmakers in person to talk about the importance of Medicare and Medicaid and the programs and services that they offer. This year more than ever, Pennsylvania's hospital community must join together to protect access to care for patients and communities. Hospitals in Pennsylvania have nearly 300,000 employees, trustees, volunteers that can be very powerful and influential in the state and federal budget processes. Your voice does make a difference, and it's needed now more than ever. I hope when you're asked to get involved, you will. Please check Care for PA in the coming weeks to see how you can help. Thank you.